Hello, this is Dr. Jonathan Silverberg. I'm an assistant professor of dermatology, medical social sciences, and preventive medicine at Northwestern University Feinberg School of Medicine. I will be discussing today the efficacy and safety of ustekinumab treatment in adults with moderate to severe atopic dermatitis by Dr. Khattri and colleagues. The study results appeared in the January 2017 issue of Experimental Dermatology. The summary of the study is that treatment with ustekinumab resulted in improved clinical response compared to placebo in patients with moderate to severe atopic dermatitis with early and sustained modulation of markers of inflammation. The importance of the study, as stated by the authors, is that the results established the likely contribution of the P40 cytokines interleukin 12 and interleukin 23 to inflammatory pathways in atopic dermatitis. When reviewing the methods, this was a randomized, double-blind, placebo-controlled, phase 2 study in 33 adults with moderate to severe atopic dermatitis. Patients were randomized 1-to-1 to ustekinumab or placebo at weeks 0, 4, and 16, with a crossover at week 16. The dose of ustekinumab was analogous to that of psoriasis, so 45 milligrams for patients weighing less than or equal to 100 kilos, and 90 milligrams for patients weighing greater than 100 kilos. And background therapy consisted of triamcinolone 0.025% twice daily, which is a low-potency topical corticosteroid. The primary and secondary efficacy endpoints were a 50% or greater decrease from baseline in the scoring of atopic dermatitis, or SCORAD 50 score at week 16 or 32 respectively. And these are the key findings reported in the study. So 33 patients were randomized, with 21 completing the study through week 40. 9 withdrew due to a lack of efficacy, 5 of which were in the ustekinumab group and 4 in the placebo group, but none discontinued due to an adverse event. There was a similar decrease in SCORAD from baseline through 40 weeks in both groups, and at week 16, 31% of the ustekinumab group and 19% of the placebo patients achieved a SCORAD 50. Responses were relatively flat in the placebo group between weeks 2 and 16. And the number of SCORAD 50 responders increased through week 20 in the ustekinumab group, decreased during weeks 16 through 28, and then remained stable from weeks 32 to 40. The SCORAD 50 results suggest an optimal response 8 weeks after administration of ustekinumab in this study. And gene profiling showed a strong treatment effect with ustekinumab, but not placebo, by 4 weeks that increased through 32 weeks, and which was 16 weeks after that last ustekinumab injection. And the same treatment effect was observed with Th1, Th2, Th17, and Th22 inflammation. 14 patients experienced a total of 24 adverse events, all of which were mild or moderate, and there were no significant differences between groups with respect to the frequency of adverse events. So when approaching this, and my commentary and analysis of the study, here are my thoughts of this particular study. So, ustekinumab is a relatively well-tolerated treatment, really across the board when it's used in psoriasis, and is something that from this study we can see is well-tolerated even in adults with moderate to severe atopic dermatitis. But based on the results, may not be a reliably effective treatment or consistently effective treatment for moderate to severe atopic dermatitis. Combination therapy with ustekinumab and topical corticosteroids, as used in this study, was not significantly more effective than placebo plus topical corticosteroids. So while the study demonstrated numerical differences between the groups, they were not statistically significant. With respect to how do these results impact the current state of patient management, there may be a small subset of patients who might have some clinical benefit from ustekinumab. However, we don't really have a way at this point of predicting who those patients are. And, from my own personal experience, I've used ustekinumab off-label in a number of patients with moderate to severe atopic dermatitis and seen no improvement. And not just that it wasn't effective enough, but as if it wasn't even touching the patient, as if it was almost treating the wrong disorder. And again, in some patients, it may be that this is a more effective treatment for psoriasis than for atopic dermatitis. And currently, ustekinumab is not recommended as a treatment for moderate to severe atopic dermatitis. Now, the study was associated with a high clinical response rate in the placebo group. And this was likely because this is not really just a placebo group, but this is a group that's using a fairly aggressive daily or twice daily concomitant use of topical corticosteroids. And it sheds light into the design and analysis of future studies that use combination therapy, that whenever you're testing a systemic agent together with a topical corticosteroid, one can expect much higher response rates in the placebo group because the topical corticosteroids are providing some benefit there. And so future studies really need to take that into account with respect to, the design of the study, the powering of the study, and the analysis approach. But there are still some questions that remain unanswered. And might there be a subset of moderate to severe atopic dermatitis patients that have clinical benefit from ustekinumab? Perhaps. But if so, which subset? Because it doesn't seem like it's all patients that are benefiting universally from it. And I think future studies are certainly warranted to answer some of these questions.